Okay, we're going to continue along our tour of the skull, and specifically the neocranium, which is, excuse me, not the neocranium, the neurocranium, that is housing and protecting the brain and the organs of sight, hearing, and balance. One of the bones that we did not get to discover yet of the neurocranium is the sphenoid bone. In the sphenoid bone, and I've employed the use of our color coordinated skull here. As you can see, we're looking for the sphenoid, which is pictured in red. And really, to be able to get to the sphenoid, we've got to remove some other bones, particularly the bones of the face, which we'll take out here. Now we can start to see a bit of the sphenoid, and then we can remove actually the frontal bone as well. So let me just remove that. And we can start to get a better look of the sphenoid. Now, one of the things that helps me remember the sphenoid is, I think, butterfly. This particular bone looks like, as we look from an anterior to posterior view here, it looks like the shape of a butterfly. So that I can zoom into some of these little areas, I'm actually going to remove this from the rest of the skull. And then we'll be able to focus on some of the key areas that you're going to want to be able to identify and become familiar with. So a couple of landmarks that we want to look for, as we mentioned, here's the anterior view. And then if I turn it, so now I'm reorienting you to this would be posterior, and this side then would be anterior. So posterior here, anterior here. And one of the things that you can think about is a butterfly has got to have wings. So the sphenoid bone naturally is going to have wings. So we can describe these wings as the greater wing here, and we have two of them on either side, the greater wing, and a lesser wing. So the lesser wing would be marked in this particular region. Okay, greater and lesser wings. We can then start to identify particular landmarks. Here we have the dorsum salae. Dorsum salae. And that's really an extension of the clivus, or clivus as it's sometimes pronounced. So it's extending in this region. And we have a couple of processes that we can identify as well. Let me just turn this a little bit more so you can see this. So this would be our posterior, because remember, this is posterior and this is anterior. This would be our posterior clinoid process. This would be our anterior clinoid process. Now, if we look here, there's this little bit of a almost like a fossa or a little dip or valley that comes off of the dorsum salae here. And this little area, this dip, if you will, we call the sella turcica, or it's also referred to as the hypophyseal fossa. And we'll talk about some of the importance of these particular structures at a later time. But this is an area that basically is in between the dorsum salae and the lesser wing as they emerge right here, just a bit further anteriorly. Another area that we're going to want to address is, you can see that our butterfly here, our sphenoid bones, has several holes through it, or canals through it, in which important structures are going to go through. Now, we won't go necessarily into what structures are going there, but what I do want you to be able to identify is that there's a certain foramen here that we want to be able to recognize. If we start most superiorly here, again I'm going to zoom in a little bit further, just medial to this lesser wing, there's a canal right here, and we refer to this as our optic canal or our optic foramen. Obviously that's going to take the optic nerve to the eye socket. If we go just a bit inferior, you can see this opening right here, right under the lesser wing. This is our supraorbital fissure. Or excuse me, it's the superior orbital fissure. It has been referred to as the supraorbital fissure at times, but in your packet we refer to it as the superior orbital fissure. Okay, if we travel just inferior to the superior orbital fissure, we come to another foramen here. We call this the foramen rotundum. Foramen rotundum. And naturally you have them on both sides. So here's our superior orbital fissure here, and our foramen rotundum right there. If I continue to travel posteriorly and inferiorly, we come to another opening, and I'm going to turn this slightly so that you can see. See how this looks like an oval shape? We refer to that as the foramen ovale, okay, because it's shaped just like an oval. And then our final foramen that we want to be able to identify is this last one. It's the most lateral, and we can see them on both sides, and that is our foramen spinosum. Foramen spinosum. So that takes us on our tour of the sphenoid bone, which, as I mentioned before, think of it as the butterfly with the greater and lesser wings, and many, many canals for important vasculature and important nerves to go through.